record on this computer. Cool, so we're recording now and we'll get people in.
Yes, there was a time where I was like, why am I doing that?
Just trying to find out how to mute this one.
It should be gone anyway.
All right, guys, I think we'll get started now. So hi, everyone. My name's Sachin. I'm one of the junior doctors working at the Royal Free Hospital this year. And we're really glad to be presenting the second part of our Applications Masterclass series today. And this is on MSRA preparation. So just to give you a bit of information about the webinar series, it's a 4-part series. We had our first part a few weeks ago, which was on applications and portfolios. Today we've got our MSRA talk, and then throughout January and February, we'll have talks on interviews and job selection. So please keep an eye out for those. I'm sure they'll be really good as well. A little bit of background about who we are. We're from a society called IR Juniors, which was a new online platform created around a year ago. And our main aim was to raise awareness of interventional radiology amongst junior doctors and medical students. It was created by 4 foundation doctors, all interested in radiology and interventional radiology. And over the last year, we've grown our committee and are continuing to grow it. And as I mentioned, our primary aim is basically to raise awareness of interventional radiology. And we've done that through creation of a website and through our social media presence. And we're continuing to create new events as well as advertise existing IR events. And if you're interested in getting involved with us, please do drop us an email. We're always looking for enthusiastic people to join our team. We've had lots of previous events, such as previous IR webinars, and we've got lots of upcoming events, such as a radiology finals conference and an IR conference. We've got our social media presence on Facebook, Twitter, and Instagram, so please do follow us on those and have a look at our website, which has a lot more content on it as well. And these are a couple of examples of the previous webinar series we've held. We had one in collaboration with the BSART, which was the Taste AR webinar series, and we had one in collaboration with Proximi, and you can see the contents of the different talks that we held over here. So they are recorded and online, so please do have a look at those. Some really interesting talks there as well. So I'll now hand over to our speakers. We've got Dr. Rahul Kumar and Dr. Shoaib here today. And these are both ST1 radiologists at Guy's and Tommy's. So I'll hand them over for the MSRA talk today. Rahul?
Hi, it's all okay. Can you see the screen?
Yeah, we can see it.
Perfect. Hi, everyone. Welcome to the MSRA talk. My name is Rahul, and I'll be presenting this talk with a friend and colleague of mine, Shoaib. So as Sachin mentioned, we're both working at the Guy's and Tommy's training scheme right now. It's good fun, so you've definitely made the right decision. I hope this talk helps you and provides you with some informative ways to tailor and shape your revision for this exam that is very important, and more so than it has previously been. So let's get into it. So the MSRA, it's a computer-based assessment. You sit at your driving test center, the same place where you sit your driving theory test exam. And it's used by a whole bunch of specialties ranging from neurosurgery to clinical radiology to basically help with the application process, because a number of applicants that are often exceeding the 900,000 mark can't all be interviewed. So the point of this assessment is basically to whittle down to a sensible number that can be interviewed. So this has been ongoing since 2016, which is when it first became a part of the clinical radiology recruitment process. And that's the year when the number of interviews were set to a maximum of around 600. And it's been used every year since then. So every single year until, including my year, so the 2020 application process, it contributed a third to the overall score, which you receive after your interviews have happened as well. And a third is a large chunk, so it can make a significant difference to anyone's application. And we'll discuss later on how big a difference it can make. So I guess this basically split into two main parts. One part you can do lots of practice and preparation for, which is the clinical problem solving. Very much like you'd revise for a medical school finals exam. But this time, because I guess we're all in clinical medicine of some form, it's very much practice question based, as opposed to going through lots of textbooks again and having to make lots of different notes. And then there's the part that is, well, we'll cover it and we'll definitely go through tips in terms of how you can make the best of the SJT section in the exam, and cool things you can do to make sure you manage your time well. However, it is undoubtedly the most subjective part of the exam, which is very difficult to predict, very difficult to advise people how to exactly tackle. And a lot of it on the day will be a game of luck for the professional dilemma section, which is a situational judgment test. So, as I said, so what's new this year in the recruitment process? So unlike ever before in clinical radiology, this time the top 55 candidates in the MSRA will not be required to attend an interview. This could be really good for you. It may hinder like other applicants, but overall, if you score really well in the MSRA, then you'll be placed into the selection group of people who will then be, the scores will be corroborated with their validated self-assessment score, which I understand you guys will have all either already submitted or are going to be submitting during this month. And based on that, you'll be ranked from 1 to 55. And everyone else after that, so 56 onwards, will have to attend an interview of some format. So this year, there's only one station in the interview, and that's because the portfolio station, which normally happens where you self-score in advance and then justify your marks to the two consultant radiologists, has been taken out for presumably COVID-related reasons and administrative purposes. And they're now going to be asking you to upload all your evidence online so they can score it electronically. The plan B, so if their plan A doesn't go to plan because of lack of clinical staff, lack of admin staff to coordinate the whole recruitment process, is instead of having the MSRA weighted at 33.3%, like it's always been, it'll instead be weighted at 50%, with the other 50% coming from your validated self-assessment score. So all in all, it's a very important exam. So let's go over how we're going to put ourselves in the best position to do well on it. So the professional dilemmas. So this is the part we'll start with. So it is a situational judgment test. Many of us are familiar with these tests because a lot of people listening, I'm guessing, will have sat one when they applied for the foundation training program. And it's actually a very similar style. And I'd say a lot of the lessons, the principles, the domains that are tested are very transferable to this exam. In fact, a lot of the times when the question stem says in the FPAS papers, you're an FY1 doctor, if you just convert that to FY2, in the vast majority of situations, it's still applicable. Professional integrity, the principles remain the same. Dealing with patients in an empathetic and sensitive manner stays the same. Coping well under pressure stays the same, and all the principles underlying these things don't change from exam to exam. So there are actually lots of resources available that are geared for other SJTs. So maybe not the MSRA, maybe it's for the UK Foundation Training Application Program. And those are still applicable and still can be used, and we'll get to that later. So this segment of the exam lasts 95 minutes and consists of 50 items. The split between the items is roughly half and half. So half the questions are rank the following 5 options in order. So you get a scenario, a clinical scenario about a problem where your judgment is being tested, and you will be expected to rank the best thing you can do in that situation and the worst thing you can do in that situation, and then the other 3 in between. So out of 5, you'll be ranking the best answer, the worst answer, and then the other 3 remaining in between. And the other half of the exam is choosing the best 3 options out of usually around 8 in a situation that together will address the clinical problem that they've posed to you. And I say the word together with emphasis because it's really important to remember that it is the 3 things you can do that in conjunction with each other will best resolve a situation. Now, that's not true in the first type of question where you're ranking options in order. You're not doing them together, and you're certainly not doing them chronologically. It's literally the best thing you can do and the worst thing you can do. So there'll be 50 items, as I said. If you are stuck on an item and you're wondering in your head, wow, I really don't know the answer to this, it's worded really badly, one can hope that it's one of the 8 items that's being piloted and doesn't actually count towards your score. It's just being tested for future examination purposes. I remember certainly hoping that in my exam, when I was encountering some difficult questions, I just think, hopefully this is one of the pilots. Still, like, try your best because none of us know which ones are the pilots. But that, in my head, made the exam situation a bit calmer because you don't want to get stressed out. So the general advice I'd say is in terms of how you can prepare for like any situational judgment test. So there's behavioral indicators that are linked to each of these 3 core domains that are on the previous slide. So professional integrity, coping with pressure, and empathy and sensitivity. They're on their MSRA blueprint, and they basically outline key attributes, key principles that you need to keep in mind when you're answering these questions. I wouldn't go so far as to say that try and map every question in your head to one of these attributes to see which ones are being tested, because one question can be testing multiple different attributes. But if you get into that mindset of thinking that, okay, this question's really asking me about confidentiality, or this question is really trying to get me to think about empathy, and that's the highly weighted skill that's testing here, then you can start formulating sensible like answers in terms of what they're hoping you're going to click on as the top option and what is definitely the wrong option. Just like we all did for the UK Foundation Training application, GMC's Good Medical Practice, which basically summarizes those domains and spells out very clearly for you the type of behaviors expected of a doctor practicing in the UK. Reading that will obviously be of value to you. So those two things I'd say are very important reads before the exam. And on all the websites that I've looked at, and when I was applying and today in preparing this talk, I found that there are no official resources for the MSRA, apart from like there's one little MSRA sample questions where it's literally got like 2 to 3 questions to show you the type of thing that you're going to be asked. But I remember when I was preparing for this exam, one of the most valuable resources that I had, and indeed one of the only resources I used for the professional dilemmas section, were the 2 official past papers that we were given to use in the UK Foundation Training application, that SJT. And I found that the questions themselves, the answers, and most importantly, perhaps the explanations that tell you how and why everything is ranked in a particular order, what skills, what sort of domains are being addressed in each order, and why this one answer that's very similar to another answer, why that one's better. So I remember going through those 2 official papers time and time again, at least 3 times each, to make sure that I understood the rationale and reasoning that the subject matter experts think about when they're writing these questions. So I definitely recommend doing those papers. So more specific advice for the different types of questions you'll have. So the ranking questions, when there's a scenario and you're asked to rank 5 different options, what I did is rank the first and the last quickly, because it is about timing as well. Like if you really want to sit there and get knee deep into a question and then try wondering about it for like several minutes, I thought that would be a waste of time that I didn't have in the exam. So I thought the best thing to do is pick the most appropriate answer and the least appropriate answer first. Now these 2, to the online, it says that it's not going to be like 100% clear what's the least appropriate, because they're not going to say anything wildly wrong. But like I found in the exam, certainly like the most appropriate, least appropriate were quite easy to pick out first. And then once you've done that, you have 3 left where you have to rank the middle ones. Now these ones were tricky. They were tricky for the foundation program. They're still a bit tricky now, but that's something that you can't get away from. And that's where we come on to bullet point 2, which is if you're stuck ranking the middle options and it's not very clear to you, use a best guess and flag the question approach, which is basically you've got the first most appropriate, you've got the least appropriate, you've got 3, you have a vague order in mind. You've already spent a minute and a half, a bit over that allocated time you in your head were going to allocate per question. Maybe it's best to make sure you've answered it and rank the middle options in something that's sensible, in a sensible order, and then you can just flag the question and come back if you have time. And that basically means that if you have time at the end, because you've finished, that's great. Come back, look at the question, reread it again, and then finalize your answer. Or at least if you don't have time to come back, then just like it was in the SJT, it's not that you need all 5 in the right order to get the marks. You need all 5 in the right order to get the full marks for that question. However, you will be awarded part marks for getting parts right. So identifying the best answer and the worst answer, and even getting like 1 or 2 of the middle options in the correct position, you can still probably like get over half of the marks for that question. And I think that's really important to remember, because that was my technique for the original SJT we sat in the foundation program. And I think applying that same technique again is what really helped me in the exam. And of course, as I said before, in these scenarios, remember that the actions in each scenario are discrete and should not be thought of as chronological. So it's not like the most appropriate answer and the second most appropriate is what you do after that. Like after you've done the most appropriate, it's either or. So it's not doing both. And the multiple choice question advice is, so this is where you have a scenario, you have 8 options and you have to pick the 3 best options that together address a situation. So for this one, I just keep that in mind, that it's what's together. And often in this type of question, I found that sometimes the first option and the second, like you can think of two things that would address the situation. And then the third is like a best guess. And again, it's not that you need all three to get that full question right. It's that two is a good shout. And then if you know the third, that's great. If you don't, best guess again, because it's better to have something down than nothing down. There is no negative marking in this paper at all. So with that in mind, I thought I'd take us through, so this, an example question of like the ranking ones, which in my opinion are the slightly trickier ones that we all need to navigate. So if I just read out the question. So a patient, Mrs. Matthews, has been admitted for investigation of abdominal pain, which her husband is aware of. You are asked to take a telephone call from him, Mr. Matthews, who is asking for an update on his wife's condition. You have just found out from a urine test that Mrs. Matthews is pregnant. Rank in order the appropriateness of the following actions, 1 being most appropriate and 5 being least. Now, just from reading the stem of this question, you can sort of get a hint of what this one's all about. So it's about confidentiality. And this is from the foundation like sample paper, but it's just as relevant here. And indeed, there were lots of questions like this that would come up in MSRAs. So reading the options, so A, tell Mr. Matthews that he will need to speak to his wife directly. B, tell him that you would like to obtain his wife's permission to speak to him first. So that sounds almost like, it's beginning to sound quite a sensible option to me. C, senior colleague, yeah, maybe. You can get a senior colleague involved and before speaking to him. I can imagine it may irritate the husband doing something like that when he's like anxious and is desperate for information. D, you can tell him you're currently investigating, which I guess you are, because you just have a result. The question, like the stem of the question doesn't suggest that the whole, like you've got the full workup done and everything's finished. You've got one test result. And the last one, tell him the answer. So I guess in my head, the most appropriate and the least appropriate at the very least became quite clear. So B is gaining the consent from the patient, which suggests to me that it's probably the most appropriate. And E is breaking confidentiality, i.e. the least appropriate. Now we've got those two in place. So that leaves A, C, and D. So if we just look at A again, so tell him that he'll have to speak directly to his wife. Potentially, like you can see that that's quite sensible because then you're not breaking confidentiality. But is it as good as option D, which is just tell him you're currently investigating, because which is what you are doing, and it gives you a bit more time to figure out to actually gain that consent in the first place. So I think potentially I'd rank D as the next best thing to do after B. And then that leaves A and C really. So just putting B, D, and E, which I guess you can all agree that wasn't the hardest thing to do. We've got a fair chunk of the marks of this question already. At most, the thing that's going to go wrong with the last two options is that we're going to rank them in the wrong order. But even then, like at least to me in my mind, when I was doing this technique in the actual exam, it was a bit reassuring when you can think like, okay, it may not be fully correct, but you're almost there at the very least. So between the ones that are remaining, so A and C, tell him you'll have to speak to directly, or tell him that you'll need to discuss the case with a senior colleague before speaking to him. So to be honest, I don't know what option I'd rank those in. I'd think in the moment, maybe that I'd go with option A and then C, just because it may seem you're being a bit more evasive if you choose option C. And as I said, like, I don't know if that's 100% right. I think it may be, because I don't actually remember when I took this question, but like it may be, but it sounds reasonable. And in my head, that one flip, that if we've got C and A in the wrong order, that's still sensible. And if that happened in most questions, then that's still a fair chunk of the marks, because there'll be easier questions that you've got all of them right in. There'll be questions like this where you've used the best guess and flag method, and then there'll be questions that are really tough, which you can spend more time on at the end if you've used these other methods. Okay, so that was just a quick insight into like just telling you a few key points. That one, this question isn't from an MSRA sample paper, it's from a UK foundation training sample paper, but it's just as relevant. And two, just using key methods like that about selecting the best answer, the worst answer, then the second best, leaves literally one one option left, which is either put AC or CA, like, and that's where you are here. I'll now be handing over to Schwabe to take you guys through the clinical problem solving section of the paper.
Hi everyone, my name is Schwabe. I'm one of the radiology trainees at Guy's and St. Thomas's, and thank you so much, Rahul, for going through the SJT section. I hope you can all see my slides and hear me okay. Just let me know in the chat if you're having any problems. Just one little thing I will add to Rahul's explanation about the SJT is the questions start off really, really easy in the real thing. So don't get this false sense of security that, you know, you start off, you do the first 2 or 3 questions, it's really, really easy. And then all of a sudden the questions get a bit harder and a bit harder. So just prepare yourself mentally for that. You know, it's fine. You've all done the SJT at some point before, and I'm sure you'll all be absolutely fine. The fact that you've tuned into this talk shows that you're all very switched on. So that's good. But moving on to the actual clinical problem solving part of the exam. This is probably what you're more familiar with. It's very similar to finals. I would argue that it's actually a bit easier than finals. It's about 75 minutes long and you have roughly 100 questions. Half of the questions are single best answers and half of them are extended matching questions. So the single best answer questions are literally MCQs where you just choose the correct answer and then move on to the next question. In the extended matching question formats, you have a few options and you need to match them to the correct description. And we will have some examples of this. As I said, I would argue this is probably the slightly easier section of the paper because we're all familiar with doing this at finals and postgraduate exams. It's all very similar to that. Whereas the SJT is something which you only sit once during the foundation program and then kind of never look at it again. So these are the different topics which can come up. And the one annoying thing about the MSRA is that it covers a massive amount of knowledge. So although you don't need to have niche specialty knowledge, I would say the depth isn't that large, but there's a massive breadth. So right from cardiovascular to gastro to resp, all of your standard medicine, all of your standard surgery, as well as specialties like pediatrics, obs and gynae, psychiatry. You need to cover all of these things. And the best way really to get to grips with this is just to do as many questions as you can from the various question banks. And at the end, I will go into which resources I found most useful when I was preparing for the MSRA. Okay, let's have a look at this SBA example. So I think you should be able to comment in the chat. Comment what answer you think is correct. So 10-year-old child with sickle cell disease presents with a swollen finger. What is the likely causative organism? Okay, so we're having a few issues with the slides. Let's see. Can you guys see the question?
Not yet.
Okay, just give me a second. I'm going to try re-sharing my screen. I do apologize. Any luck? Can you guys see?
Yeah, can see.
Perfect. I apologize. Let me just quickly go back through what I was talking about. I think you all probably saw that slide. So the key point is half of the questions are SBAs, half of them are EMQs. And these are all the specialties that are covered, and we'll get these slides to you. So don't worry if you missed what I said. The point is the MSRA covers a large number of specialties. It's not so much about the depth, but it's more about the breadth. So, you know, covering all of these topics is really important. And this is the question. So hopefully you can all see that. And if you just comment the correct answer, what you think the correct answer is in the chat, you can either say A, B, C, D, E, or you can write the answer out in full if you wish. So what I really want to get across in this example is this is literally the amount of information you're given in the exam. It's not a long paragraph where they go into the investigations, the examination findings. It'll literally be 2 lines where it's like a 10-year-old child has sickle cell disease and they have a swollen finger. What is the diagnosis? What is the organism? What is your management? So it's simple case scenarios. And for the 4 of you who have said A, you are absolutely correct. So the point of this isn't really to teach you knowledge. I'm sure most of you knew that salmonella was the answer. The child has osteomyelitis. He's got sickle cell disease. The most common organism is salmonella. But the point of this question was to show you that actually you don't get tons and tons of clinical information. You're given 1 to 2 lines, maybe 3 lines at a push, and it will just ask a very straightforward question. And the vast majority of questions are exactly like this. Okay, so sometimes I think that the question banks aren't really representative of the questions in the MSRA because they'll have paragraphs of information which just isn't really representative. Okay, so this is an example of the extended matching question. You'll be given a list of options from A down to H or J. You might be given 10 options. And then you'll have a list of diagnoses or a list of presentations or a list of investigations. And you have to match what's down here to one of the answers which is best suited. So for the malignancies below, choose the most likely marker to be elevated. So if we start from the top, what do you guys think the answer is for pancreatic cancer from A to H? Good, A. And what do we think it is for ovarian cancer? Again, this isn't a test of knowledge. I just want you guys to get used to the answers. Yeah, good. E. And for hepatocellular cancer? B. And for choriocarcinoma? That's a slightly more tricky one. Good, F. I'll try to color code it according to the correct answer, but the point is that's what the EMQ questions will be like. Again, they're not that difficult. They'll be fairly straightforward, but there may be one tricky option in there to catch you out. So in this case, it would have been choriocarcinoma would be the slightly more tricky one amongst these 4. You'll be given a list of options like this, and you basically just have to match it to the correct option below. So you've done your SJT, you've done your clinical part of the exam, and you've done all your portfolio, your interview, etc. What score do you actually get at the end of the process? So the whole process is marked out of 120 points. Previously, the interview section would be worth 80 points and the MSRA would be worth 40 points. But this year, as Rahul mentioned, the portfolio part of the interview is going online. So that means you get 40 points for the online portfolio section, also known as your verified evidence score. And that will be marked by 2 separate assessors who will each give you a score out of 20. And we can go into more detail if you guys wish what exactly the portfolio consists of. But I'm sure the IR guys have got a separate talk on that. The interview station, which more looks at your commitment to the specialty, is again marked out of 40 points, and you get 20 from each interviewer. And finally, your MSRA score is scaled down to 40 points. So each one of these domains counts for a third. And therefore, it's really important that you focus on the MSRA, because a third of your whole mark is going to be based on that exam. And that can actually make a big difference as to where you're placed. So Rahul put this together, and these are two separate candidates, real life examples from last year as to how they scored in their MSRA. So one candidate got, just to give you some brief, basically, each section is scored out of, well, actually, no, each section isn't scored out of anything. The mean mark is 250, okay? So the mean mark for each section is 250. Candidate one got 272 in the SJT part, and he got 295 in the clinical part, giving a total score of 567. And that was then scaled to about 30.5 out of 40. A different candidate scored a lot higher in the SJT section, so 297, did very, very well. That's a remarkably good score. And also did very well in the clinical section, 285, giving a total score of 582. And that then gets scaled to 32 out of 40. The point is 500 is the average mark. Anything you get above that is going to put you above the 50th percentile, okay? So focus on this exam, it is very important. I saw a few of you in the chat and on the Slido were asking some questions about you know, how many people interview, how many people apply, etc. So I put this little table in. The actual number of radiology posts available increases with each year. And last year when me and Rahul applied, it was roughly 300 and roughly 1,000 applicants. So, you know, it's not a bad ratio, I'd say, 300 in 1,000. So that's about 30% chance. I would say those odds are quite good compared to some of the other specialties. The way the SRA traditionally has worked is it's used to whittle down the numbers of applicants that get interviewed. So as Rahul mentioned this before, previously the top 600 in the SRA got interviewed. But now things have changed slightly this year with the top 55 getting automatic places, etc., as was mentioned before. But this just gives you a slight idea as to the number of applicants and the number of people who take the SRA. And as a rough timeline, what's going on? So I'm sure you guys have all applied by now. I believe the application deadline has gone. You should be receiving your invitation to sit the MSRA at the beginning of January. And then you'll be able to select a date and a test center. And the MSRA typically takes place at the end of January, towards the beginning of February. So here it's the 28th of Jan to the 12th of Feb, 2021. You will then get your results and you'll sit your interview and all your scores will be put together and you will be given a score out of 120 and you will then be ranked and given a place according to your ranking. So I think this is probably the most important slide in the whole webinar. So what should you guys use to prepare for the MSRA? For the SJT, as Rahul quite rightly said, the best resource and pretty much the only resource that's worth looking at in terms of questions is the foundation program practice papers, which can be found on this link here. The slides will be disseminated, but you're welcome to take a screenshot if you wish. I would not bother using any other resource like Past Medicine, etc. for the SJT section, just because the questions aren't representative. Often the answers and the explanations given are incorrect and it just leads to more confusion. And I feel will just make your score worse. It's better to practice from a known resource where you know the answers and the explanations are definitely accurate. So please do check this out. For the actual clinical part of the paper, I'd recommend Past Medicine, MCQ Bank, or eMedica. And when I was preparing, I did questions from all three of these questions banks. And I found they were all useful. Probably the most representative is the MCQ bank. Past Medicine and eMedica, the questions aren't really representative. MCQ bank, the questions are very representative in the style that I showed you earlier. Here are some more links to information about the MSRA. Again, you can check that out later. But I guess we'll move on to the Q&A. So if you do have any questions, please post it on the Slido and me and Rahul will try our best to get to them.
So there's one question that's come up on the Zoom group chat, which was, how different is the professional dilemmas to the SJT? And I'd say they're actually incredibly similar. As I said before, the domains that are being tested have lots of crossover. You're looking at things, everything from confidentiality to ethics in the workplace, to ability to work under pressure and cope, prioritize. All of these attributes that they were testing for people to get into the foundation training program are still being tested again. So I'd say the skills are almost completely transferable, and which is why the main resource that me and Shui both used when we were preparing for this were the 2 official foundation program past papers, because those are the only ones that have gone through the rigorous testing process where subject matter experts have sat down, given detailed answers with rational explanations as to why they've ranked particular options before others. So that's what I'd really recommend doing.
So just looking at the Slido, someone's asked, is past test not recommended? I just personally never use past test. I'm sure their questions are also decent for the clinical section. I use PassMed, eMedica, and MCQ Bank. As I said, don't get bogged down with using too many resources. I would just stick to, say, 2. And of those that I mentioned, as I said, MCQ Bank, I reckon it was the most representative. So someone has asked, did you use multiple question banks? I personally did for the clinical part of the paper. The more questions you get through, the more knowledge you take on board, and that's going to transfer over to the exam. But that was just my style. I don't know if, Rahul, you used multiple question banks.
So I only use the past medicine question bank, and it's really important that we go over, when I say use, what exactly I mean. So I don't just mean doing the questions again and again, because it's very easy to, once you've done them all once, the second time just look at and recognize the right answer and move on. To effectively use the question bank, it involves answering the question, and regardless of whether you got it right or not, going down to look at the explanation and then the little chunk of text they have between each question that links it to the relevant topic in the textbook, in the past medicine textbook, where you can learn the surrounding aspects of every single question. And really that basically means if questions like, for example, let's take a sexual health question that's talking about a particular type of infection like bacterial vaginosis and what type of discharge you'd expect, what the treatment is. Yeah, it's great to know that one. But if you're making the best use of the question bank, you're going to go and read on all of the different types of infections, how to treat them all, and what their characteristics are. So that's what I mean by effective use. So do that for every question, at least the first time. Go through the question bank multiple times, and then I'd say that'll put you in good stead. So personally, I use past medicine, but I don't think, like, for the clinical part, I'd recommend, like Shoaib said, eMedica's. I've heard a lot of friends use that. The MCQ bank is good as well. It's about what you like and what suits you. So, and whether you want multiple resources.
Yeah, I think that's a really good point. Don't just do the questions, read the little explanation about the answers and the text underneath. I think some people are asking about bookwork, and there's people who have been out of medical school. I personally would not touch a book for this exam. I just think it's quite inefficient, and the highest yield thing you can do is just work through tons and tons of questions. Even if you don't think you know much, just start working through the questions and you'll start to pick up knowledge. There's loads of question banks out there. If you want to, you can work your way through all of them slowly. That's the best way to assimilate knowledge, in my opinion.
Yeah, I completely agree. So I think personally, I didn't use any proper textbook because it felt like in medical school that was quite appropriate, but this is very clinical. The questions are testing things that we would either remember from medical school and be applying now, or really based on our everyday practice? Like, for example, the things you do in a septic screen, what order, the findings and what they mean. So I'd say it's not really like what I did, but then if you feel you're doing questions and it's not making any sense, like for me, if I tell you like the dermatology section wasn't my forte, and I found when I was doing past med, I got a lot of those questions incorrect. So what I did is on the British Dermatology Society website, there's a medical student handbook, which is it's really thin, really concise, has the pictures, and it has all the exam relevant keywords, buzzwords you need to remember, and the treatment. So just reading through that really quickly just made sure that for that section, like all the questions that came up on dermatology were already covered. So that was the only sort of, I guess, textbook I used. The rest of it was just past medicine. There's some other questions coming through about our past papers available. So for the MSRA, there's a couple of sample questions, I think, on a document that I literally found like as a link on the RCR website and off the main MSRA website. But I don't think there's any actual past papers available. So all the places I've read just say that there's no official resources recommended for this paper, which I guess leaves it to us to sort of figure out what works best and what has historically worked best for the candidates who apply.
There is a link to those few sample questions. There's literally only like 2 or 3 sample questions, but it's in the resources section of this PowerPoint if you're interested. Do you recommend any paid MSRA courses? I personally think, you should avoid paying for MSRA courses because ultimately you just want to do loads of questions. I didn't go on any courses. I don't really think they'd be worth the money. So I would avoid them and just do as much as you can online.
I agree with the courses. Yeah, didn't go on because I feel like what can they tell you in a course on the SJT? Like, I think we've been through like these techniques weren't from a course. They were literally like logistical good sense in terms of how you trying to maximize your marks. I'm not saying that like, if you really think about it, I think it came down to just under 2 minutes per SJT question if you split it up evenly. It won't be split up evenly in the exam because there'll be some that are really easy for you, some that are longer for you. It's just about the techniques that work best for you, and you'll figure that out in the practice papers. So
I think this is a good question. How long does it take to prepare? I guess that's, you've got about a month and a half now. So that's enough time. If you start cracking on from now, doing questions, you'll be fine. So don't worry if you've left your revision late. I think I started revising in now or after sort of mid-December time. So just start now and that will give you plenty of time till the end of Jan to properly do enough questions and get your way through those question banks.
I can see some questions coming through on the Zoom group chat that are very much based on uploading evidence for the portfolio. So this is actually a new aspect of the application process this year that didn't happen last year. So I personally don't know yet, and I think it'll be coming out soon in the next couple of weeks because there's a deadline, I think, of 23rd December, by which point all the documents should have been uploaded. So I think we'll know soon in terms of how many documents they're going to allow you to upload for each section in their evidence. And the next question was, are peer-reviewed published abstracts not full articles accepted as a publication? So with regards to that question, I personally don't know this year how they're going to, I can't guarantee this year how they're going to be looking at that. I can tell you historically, in previous rounds and previous years, it didn't have to be like, I know some application processes like the INT process, etc., may require a fully published article with a PubMed ID. And I know that wasn't a requirement for the clinical radiology application. Articles didn't necessarily need a PubMed ID. I don't know if that helps at all with that question.
So I know one thing is that they don't accept, so posters and presentations don't get a point as far as I remember. It can't be a poster or presentation. That was the case last year. It has to be proper research. So if you've got an abstract on proper research, then that may well count, but it's hard to know. And the slightly annoying thing is, before in the interview, you could try and convince the interviewer, you know, if you had something, you can try and, you know, convince them that it's worth a point. But because everything's online now, you can't really do that. But regardless, just put it down, you know, and hopefully you'll get a mark. Worst case scenario, you won't get a mark, but you won't lose points for putting it down.
Yeah, so I'd say it's really important to be realistic when you're giving yourself the points. However, if there's something that's borderline, then just obviously go for the highest point. It can be brought down after, if like the consultants reviewing the evidence feel that that doesn't warrant it. However, if you felt that there's a chance it does, a realistic chance, I don't mean just like as a joke, well, like, obviously if you don't have a publication saying you do, like that's not on. But like if you have like a case report that you've published and it doesn't have a PubMed ID. So as I said, so one of the questions is, did you say a PubMed ID is required? In previous rounds, it wasn't a mandatory requirement, as far as I know, for any publications to definitely have a PubMed ID. But as I said, we don't know this year if the process has changed or stayed the same. It's too early to say.
So someone said that apparently posters are allowed this year. So if that's the case, that's great. I mean, just put it down anyway. You know, as Rahul said, I think it's reasonable to put things down which are borderline. So someone's asked a very good question on the Slido, and I'm not actually sure what the answer is, but maybe you might know, Rahul. So is the score, the MSRA score, moderated to people applying for radiology or also other specialties? I imagine your score is taken compared to everyone who sits it, right? But then you're ranked.
So for the scale, so I think what, if I'm correct, what this is asking is, so there'll be many applicants in this cycle as well who, like me, applied to both GP and radiology. So what you'll find is the GP scoring system, the total scores that you get in the professional dilemma section and the clinical problem solving are the same across whether you did it for radiology or for GP. For GP, they give you a band as well, and it gives you a clearer indicator as to how you performed. For radiology, they just give you that overall score in each section. In terms of how that's scaled, it's a separate process, because the scaled score for, as I said, it's out of 120, historically has been, so 40 from the MSRA, 40 from the, well, I guess the one station interview this year, and 40 from the evidence that you will have uploaded. So that scale isn't necessarily true for general practice, and they run their own application process. So that's that scaled score that I told you about in the beginning, and those examples that I gave of the real life candidates from the 2020 cycle, that was from the radiology process. So it wasn't from the general practice process. So I think there's another question on the Zoom group chat, which is the top 55 applicants mentioned. Is that the MSRA applicants rank as a whole, or just the ones who want to apply for radiology? So that's just the ones that want to apply for radiology. So lots of people are setting the MSRA. They're doing it for various different specialties. Obviously, like if you haven't applied to radiology, you may still have the best mark ever in MSRA. But like if you haven't applied, then they're not going to be given an offer, right? So it's only the people who've applied to radiology specifically who'll get the top 55 interview waiver.
Do we pay for the MSRA? I don't remember. If you do, it's a pretty marginal cost. I don't remember paying for it.
Yeah, I don't remember paying for it. So must be very marginal, or like.
Yeah, I don't think you do.
Okay, there is another question. What if one of the top 55 rejects radiology for something else? Is it the next 55? Okay, so that from all the literature I've read hasn't been made clear. So it's very difficult to say with full clarity. This is the first year they're doing it. Everywhere I've read has said it's the top 55 MSRA scorers who are given priority and are not required to interview. And then within those 55, their other scores, the evidence scores they have, will be added to that. And then the final ranks will be drawn from that. So that's what we know so far. So that may mean the 55th person, for example, who just makes the cut because of an MSRA mark and happens to have a really strong evidence portfolio, can be bumped up to a lot higher than rank 55 when it comes to final rankings. That's what we know so far. We don't know what will happen if candidate 30 says they don't want the job anymore. Like, do they take another one in that top 55? It's not clear from what I've read so far.
So someone on the Slido has asked, what sort of portfolio score do you need to get in? So remember, the portfolio or the electronic verification score is out of 40. So that's a third of your score. And it's quite hard to say, because if you do really well on the MSRA or you do really well in the interview, but you don't do too well in the portfolio, then actually you don't need to do well in the portfolio. But for me personally, the portfolio gives you easy marks, because there are some things which you can do to boost your portfolio score, like taster weeks, going to courses, running teaching sessions for medical students, doing audits. These are all quite straightforward things you can do to boost your portfolio. I appreciate research and getting papers and publications and doing postgraduate exams, and getting first-class degrees. Those are all quite tricky, but there are simple things you can do to boost your portfolio score. So whilst it's really hard to say what sort of portfolio score you need, just do the simple things which will maximize your score. Focus on the MSRA if you don't think your portfolio is that strong, and you should still be able to get a good place.
Yeah, I think the last question I can see on the Zoom group chat is, do you know roughly what score is needed for certain regions? So that's something that will vary year to year. There is a trend. So the trend happens to be that the highest scores, aggregate scores, are needed for the London region and other like major cities like Manchester in the UK. However, obviously it depends on every cycle where the top scorers want to go, and that will determine where everyone goes, really, because it depends on where they have planned their life and are based. So
cool. So if we don't have any more questions, then I think we can finish up there. So I can't see any more on the Slido or the chat. So thanks so much, guys. It was so useful to have some people who've gone through the process. So for everyone watching, thanks for attending our webinar. We posted a link to our feedback form. Please do fill it out. We do read every piece of feedback and try and improve the sessions for next time. And so your comments will be really useful for us to improve all the next sessions. And we will be recording or posting the recording on our YouTube channel for anyone who missed it. So thanks again to our presenters, Rahul and Shoaib, and cheers for everyone who showed up, and hope you have a good evening.
Thank you all so much.
yeah, thank you so much. Thanks everyone for attending. Hope to see some of you next year.
Definitely. Take care.
Cool. Bye, guys.
Bye-bye.
Bye.